Play is one of our most fundamental activities. Plato said, "It is the essential nature of man to play." In fact, play is undoubtedly the key element in most, if not all, of our favorite childhood memories.
What we know about children developmentally is that their language lags behind their cognitive development. Play is their language. It's how they communicate, just as adults use words.
Play is a child's way of communicating with the adults. Typically, they aren't able to put feeling words or actual words to what they may be experiencing, but through the play, they can actually give you insight into what is really happening for them.
Researchers have for centuries observed play and its obvious benefits. Mental health professionals have applied the curative powers inherent in play into a form of counseling or psychotherapy with an emerging evidentiary research base called Play Therapy.
Play therapy is a model of therapeutic intervention to use with children that helps them to develop their communication skills in a therapy situation so that they can express their needs, their wants, their wishes, and their feelings in a way that's developmentally appropriate for them.
Play therapy works because it's a natural thing for a child to pick up toys, and toys are their words, and play is their language, and it helps them to process emotions and feelings.
Although play therapy can also help older clients, especially those who have difficulty verbally expressing themselves, most clients are children. To foster play, therapists often stock a portion of their offices with therapeutic toys or maintain them in a playroom.
The playroom is a child's world during the counseling experience. It's a safe place for children where they have the freedom to express their emotional lives and to be understood by a therapist who recognizes the healing power of play. Toys are the means by which children express themselves, and so the selection of these toys to facilitate expression is critical. Examples would be dolls and dollhouses, castles, swords, pirate ships, animal figures, puppets, sand, and art supplies.
Play therapists carefully prepare for each client's first visit to their playrooms.
The child walks in and they look around the room, and the relationship hasn't started yet. So often what we call it is a safe play, that the emotional disturbance or the purpose of them being here isn't being acted out yet. I'm starting to connect with them, and they're getting a sense of me and who I am, and if I'm safe.
Kids will go where they want to go, and a lot of times it's directly connected to what's going on in their lives, things they're struggling with. Progress can be short-term, progress can be long-term. Like with any other kind of client, you kind of need to build a relationship. And it's especially important with children because, you know, they need to learn to trust you, and, you know, you're not their parents, you're not their teacher, you're a new person.
Once the child feels safe in the therapeutic relationship, the play therapist facilitates or helps the child use play to make sense of their disruptive life experiences or issues that need therapeutic intervention. Engaged side by side, using toys and expressive activities, the play therapist and child are able to better understand, identify, and try to resolve a wide range of social, emotional, behavioral, and other developmental issues. Licensed mental health professionals who therapeutically use play to better communicate with and help clients are called play therapists. Play therapists have earned master's or higher degrees and obtained significant training and supervised clinical experience in play therapy and the primary mental health disciplines, including pediatric and psychiatric nursing. Therapy is regarded by parents, healthcare providers, and insurers as an important treatment modality and utilized daily throughout the United States and more than 30 other countries.
I've seen children grow and learn about themselves in a number of different ways.
They can't change the story, but they can change their view about themselves in the story and gain their power back.
Play therapy is a valuable, credible, professional, therapeutic discipline that is developmentally sensitive in meeting the client's needs, especially if the client is a young child. Because young children's natural way of communication is play. The bottom line is, play therapy works.
For additional information about practicing, teaching, supervising, or researching play therapy, contact the Association for Play Therapy or visit its website, www.a4pt.org.